80% of women have this and have no idea. I'm Dr. Muldoon. Let's talk about it. 80% of women have uterine fibroids, essentially benign muscular masses that live inside the uterus. They can be located on the outside, on the inside, or somewhere in between. Uterine fibroids can cause irregular bleeding, sometimes pain with peeing, sometimes pain with defecation or pooping. And so it really depends on you. Now, if you come to me and say, I have zero symptoms, I feel great, but we find these uterine fibroids on your physical exam or we find them on an ultrasound, what are we going to do? Well, honestly, if you're telling us you're feeling great, you're not having any symptoms, your periods feel fine, we're not going to tell you to do anything. We're just going to keep an eye on them. What if you do have really heavy periods? Sometimes we can put you on medication. There are medications that are specifically made for uterine fibroids, such as Myfembry, or we can put you on medications that help with bleeding in general. Sometimes we will talk to you about options for intervention. So, for instance, uterine fibroids can be shrunk with something called a uterine artery embolization, essentially where an interventional radiologist puts a catheter through the femoral artery, through your leg, and they're able to shoot clots into the uterus, kind of like a heart attack, and get the uterus to try to shrink, or specifically try to get the fibroids to shrink. The goal there is to decrease the blood supply to the uterus, and as a result, decrease the blood supply to the fibroids, causing the fibroids to shrink or calcify. Now, it's hard to predict whether that'll work. It also depends on the size of the fibroids to start, but sometimes you can have really gradual improvements in uterine size and in fibroid size. Now, there's also surgery for uterine fibroids, something called a myomectomy, which is where we go in and we pluck out all the fibroids and put the uterus back together. The risk inherent to that is that you can develop some scarring within the uterus that can impact your ability to labor, meaning you may potentially need a C-section in the future, but it allows you to salvage the uterus. There's also something called a hysteroscopy if the uterine fibroids are in the inner lining of the uterus, on the inside, the very, very inside. We're able to sometimes take a camera and just shave the uterine fibroids that are inside the uterus, and that's a one-day recovery. When it comes to the final option, there's something called a hysterectomy, where we take out the uterus, but we can also leave behind portions, things like the ovaries. It all depends on what the right thing is for that patient. Additionally, the question is of whether we can do it through minimally invasive surgery, through small incisions or through big incisions, depending on what the uterus looks like. And lastly, there's also something called radiofrequency ablation. Radiofrequency ablation is where we can take essentially a fork. We put the fork right into the fibroid and then we heat it up. I guess the best way to describe it is like a microwave, right? We're using radiofrequency waves to heat up the fibroid and to try to denature the proteins inside the fibroid. In doing so, we're able to get the fibroid to potentially shrink or potentially calcify and become less clinically active. The goal there is to improve bleeding, pain, a number of different things. But again, it's not a surefire measure. Every single patient's fibroids are different. If you're having issues, specifically if you're having heavy bleeding, pain with intercourse, you're noticing significant difficulty with urinating or pooping, it's time to talk to your doctor. 80% of us have it. It's time to talk about it.